Let's explore the connection between nutritional deficiencies and nerve problems like sciatica and carpal tunnel syndrome. Sciatica can be incredibly bothersome, causing pain that shoots down the back of your leg, making sitting and driving uncomfortable. Carpal tunnel syndrome, with its pain and numbness in the wrist, can also be a major issue, sometimes even leading people to unnecessary surgery. Today we'll focus on 3 common nutritional deficiencies that can contribute to these nerve problems: vitamins B1, B6, and B12. These B vitamins are essential for nerve health, especially for the sciatic nerve and the nerves involved in carpal tunnel syndrome. We'll explore how to differentiate between a B6, B12, or B1 deficiency, so you can better understand which one might be affecting you. Let's start with vitamin B6, also known as pyridoxine. Now, there are different forms of B6. Pyridoxine is the inactive form. It needs to be converted into its active form, pyridoxal 5-phosphate, P5P, in the liver. B6 is crucial for many bodily functions, including nerve health, as it's involved in over 160 enzyme pathways. These pathways are like intricate networks of chemical reactions that keep your body running smoothly. One of B6's key roles is in the production of myelin sheath, the protective coating that surrounds nerve fibers. Think of myelin as the insulation that allows nerve signals to travel efficiently. When you lose this coating, nerves can misfire, leading to symptoms like burning, numbness, tingling, and pain. The protein that builds myelin relies on B6 for its production. B6 also helps produce neurotransmitters, the chemical messengers that transmit signals between nerves. These neurotransmitters are different from hormones which travel through the bloodstream. 2 important neurotransmitters that B6 helps produce are serotonin and dopamine. Serotonin is involved in mood regulation, sleep, and digestion, while dopamine plays a role in motivation, reward, and movement. B6 is particularly important for protecting the nervous system, especially the sensory nerves. We have 2 types of nerves: motor nerves, which control muscle movement, and sensory nerves, which transmit sensations like pain, temperature, and touch. Sciatica and carpal tunnel syndrome primarily involve sensory nerves. In my practice, I used to use a machine that measured the speed of nerve signals in the arms, called conduction nerve velocity testing. Unfortunately, back then, I didn't fully appreciate the impact that B6 and other vitamins could have on nerve function. B6 helps increase nerve conduction velocity, ensuring that nerve signals travel quickly and efficiently. It's also involved in the overall metabolism of the nervous system, providing the energy and nutrients nerves need to function optimally. B6 can even affect the nerves in your eyes. A deficiency can contribute to myopia, nearsightedness, making it difficult to see things far away. B6 deficiencies have also been linked to seizures, so it's definitely something to consider if you or someone you know experiences seizures. Now, there's a bit of a paradox with B6 that's worth mentioning. In some cases, when people start taking large amounts of vitamin B6, they can actually experience symptoms of a B6 deficiency. This seems counterintuitive, but it's thought to be due to the competition between the inactive and active forms of the vitamin. If you take excessive amounts of the inactive form, pyridoxine, it can actually block the absorption and utilization of the active form, P5P, leading to a functional deficiency. The recommended daily allowance, RDA, for B6 is quite small, around 1.4 to 2.1 milligrams. However, many B6 supplements come in much higher doses, like 50, 100, or even 250 milligrams. This can be thousands of times higher than the RDA. If you're not careful and end up taking large amounts of the inactive form, you can inadvertently create a B6 deficiency and experience neurological problems. So if you suspect a B6 deficiency, it's best to supplement with the active form, P5P, to avoid this potential issue. It's also worth noting that about 36% of B6 supplements on the market contain the inactive form, so it's important to read labels carefully. How do B6 deficiencies happen? Well, as we discussed, taking the wrong form of B6 in high amounts is one way. Other factors include gut inflammation, conditions like celiac disease or Crohn's disease, gallbladder removal, aging, which can affect nutrient absorption, certain medications that interfere with B6, alcohol consumption, birth control pills, and even genetic variations that affect B6 conversion and absorption. Dietary factors can also play a role. Foods rich in B6 are typically animal proteins, like fish and meat. So if you follow a vegan or vegetarian diet, you might be more prone to a B6 deficiency. The form of B6 found in plants is also not as easily absorbed as the form found in animal products. Smoking, diabetes, excessive coffee consumption, more than 4 cups a day, can also contribute to a B6 deficiency. Now let's move on to another crucial B vitamin, B12. I've done many videos on this topic because it's so important and often overlooked. B12 deficiency can be quite insidious, sneaking up on you slowly. By the time you notice symptoms, it might have already caused significant damage. B12 is essential for myelin production, nerve impulse transmission, nerve regeneration, and nerve growth factors. It's the key to a healthy nervous system. I wouldn't recommend taking the synthetic form of B12, cyanocobalamin. Instead, opt for methylcobalamin, which is the natural, active form that your body can readily use. The reasons for B12 deficiency are similar to those for B6 deficiency, including alcohol consumption, diabetes, malabsorption issues, birth control pills, genetic factors, and low stomach acid, which is needed to absorb B12 from food. You might have low stomach acid if you experience acid reflux, GERD, or gastritis. Two main reasons for B12 deficiency are a plant-based diet, as B12 is primarily found in animal products, and genetic variations that affect B12 absorption. Excessive folic acid intake can also mask a B12 deficiency, so it's important to be mindful of that. Lastly, let's talk about B1, also known as thiamine. B1 deficiency often shows up as peripheral neuropathy, especially in people with diabetes, prediabetes, or insulin resistance. This is because B1 is crucial for carbohydrate and sugar metabolism. The more carbs or sugar you consume, the more B1 you need. If your intake doesn't match your needs, you can end up with a deficiency and experience neurological problems, especially in the feet, hands, and other areas affected by sciatica. So if you have a history of high carbohydrate consumption or blood sugar imbalances, consider adding a B1 supplement to your routine. Other factors that can contribute to a B1 deficiency include excessive coffee or tea intake. B1 is important for blood flow to the nervous system, ensuring that nerves receive the oxygen and nutrients they need. Without sufficient B1, you can experience a range of neurological issues. The best form of B1 to take is benfotiamine, a fat-soluble version that's better absorbed by nerves and is particularly beneficial for myelin sheath health. B1 is also a potent antioxidant, helping to protect against nerve damage caused by diabetes and other conditions. So, we've covered 3 key B vitamins that play a vital role in nerve health and can significantly impact sciatica pain. You can take all 3 or focus on the one that seems most relevant to your situation. But remember, there can be other causes of sciatica as well, such as a loss of the normal curvature in the lower back.